This talk deals with the functional anatomy of the dorsal longitudinal fasciculus. The history behind the name of this fascicle is a bit confusing. What we call today the medial longitudinal fascicle was in 1846 called the posterior longitudinal fascicle. By 1895, the term posterior had been changed to medial. The term dorsalis Lange's bundle was first used in 1891 by Heinrich Schultz. This term was then translated to English as the dorsal longitudinal fascicle. After 1891, some authors substituted the term dorsal for posterior. Today, the term dorsal longitudinal fascicle and posterior longitudinal fascicle are both used to refer to the bundle of fibers described by Heinrich Schultz. Cajal tried to move away from the dorsal versus posterior labels for this tract and suggested the term the periependymal fascicle, but the name was not popular and no longer used. During this talk, we will use the term dorsal longitudinal fascicle or its acronym DLF when referring to this tract. The description of the DLF that follows is mainly based on these two books. At times, they have irreconcilable differences regarding the constituents of the DLF. In such cases, the best possible effort has been made to bring a cohesive functional and anatomical explanation to light. So first, let's address where is the DLF. You can see in this brainstem parasital fresh specimen the tegmentum, and in it a thin band of white matter hugging the aqueduct of Sylvius and the floor of the fourth ventricle, which I have now traced. This is the DLF. I have now introduced a myelin stained specimen of roughly the same area. The arrows point to an interrupted band of white matter, which I have traced. As you guessed, this is the DLF. In addition to the DLF, I like to name some structures we will mention later on in this talk. I have traced the boundaries of the hypothalamus. Now I am pointing to the septal nuclei, fornix, precommissural fibers. These fibers are anterior to the anterior commissure. Now I am pointing to the preoptic area of the hypothalamus, anterior region, tuberal region, and posterior region of the hypothalamus. The mammillary bodies, habenula, habenula interpeduncular tract, or fasciculus retroflexus, called so because in lower animals it goes backwards. As you can see here in a fish, this is the red nucleus and the interpeduncular nucleus. I have now moved the specimen to the side and drawn 7 lines to indicate level of cuts. The first cut is at the level of the superior colliculi and it is tilted down, thus cutting through the exiting fibers of cranial nerve 3. Here you can see the specimen so obtained. The arrow indicates to the dorsal longitudinal fasciculus, which I have now encircled. Next cut goes through the inferior colliculi and runs parallel to the first cut. In it, the arrow indicates to the DLF. Cut number 3 was made using the midbrain pontine junction as the landmark posteriorly, and it was angled parallel to the ones above. In it, you can see the decussation of the fourth cranial nerve, which tells us that the cut is going as desired through the midbrain pontine junction. The arrow in this frame points to the dorsal longitudinal fasciculus. I have now added a green line representing a different angle cut. The starting point posteriorly corresponds to the midbrain pontine junction, but it is more tilted caudally than the cut number 3. Such a cut produces this specimen. As you can see, it also goes through the decussation of the fourth cranial nerve. In it, you can appreciate the DLF. Cut 4 runs from the medullary velum to the middle of the pons. This cut yields the specimen we are looking at. In it, you can see the dorsal longitudinal fasciculus. Cut 5 goes from the internal genu of the cranial nerve 7 parallel to cut 4 to the lower region of the pons, yielding the specimen you can see in this frame. In it, you can see the internal genu of cranial nerve 7 and just behind it the DLF. Cut 6 is at the level of the middle of the inferior olive. In it, you can see the DLF just behind the hypoglossal nucleus. Slightly below is cut 7. In this cut, you can see the DLF just behind the hypoglossal nucleus. So we can surmise the location of the DLF as follows. The right and left dorsal longitudinal fasciculi appeared as compact tracts at the midbrain by the red nuclei running below the ependyma of the aqueduct and close to the midline below the ependymal of the fourth ventricle to the lower portion of the medulla. Now that we have looked at where is the DLF, let's try to answer what are the constituents of the dorsal longitudinal fasciculus. The diagram in this frame is extrapolated from one presented in this book. The numbers by the side match those just listed. I will use this figure to name the components and the relation between the components of the DLF. The DLF is a tract with descending and ascending fibers. It interconnects some regions of the basal forebrain with various cranial nerve nuclei, mainly those with motor visceral functions. We will first address the descending fibers. The descending fibers in this tract can be traced rostally to the septal nuclei, which you can see in this fresh specimen here and in this neuronal stained specimen here. Other fibers arise from the hypothalamus, particularly from the oral hypothalamus, that is from the preoptic area and anterior region, less so from the tuberal region and the tuber cinerum, and even fewer fibers arise from the posterior region and the mammillary bodies. These connections can lead us to the conclusion that since the oral hypothalamus is primarily responsible for controlling parasympathetic function and the DLF mainly connects with parasympathetic brainstem neurons, we can say that the DLF is to the parasympathetic system what the central sympathetic tract is to the sympathetic system. This conclusion is emphasized in this insert. Notice that the oral part of the hypothalamus is blue, as is the parasympathetic system, and the caudal hypothalamus is pink, as is the sympathetic system. So let's now explain how fibers arising from the septal nuclei and the hypothalamus, which correspond to the structures in the area indicated by the arrow, reach the brainstem nuclei. From these septal nuclei and hypothalamus structures, some fibers contributing to the DLF run for a long distance without making any intermediary stops from the basal forebrain to the cranial nerve motor nuclei, while others run for a relatively short distance and make intermediary stops along the way. Those that run for a short distance make contact with neurons in the periaqueductal gray, as highlighted in this insert, the reticular formation, as highlighted in this insert, and with neurons in the dorsal tegmental nucleus of Guden, as further illustrated in this insert. Some neurons in the periaqueductal gray contacted by the DLF fibers send axons to the superior colliculi, as illustrated here, while others send axons back to the DLF. This later arrangement is followed by the neurons in the reticular formation, as illustrated here, and by the neurons in the dorsal tegmental nucleus of Guden, as illustrated here. Being that this is the second time I mentioned Guden, I could not help telling you a little bit about him. Bernhard von Guden was a psychiatrist and an anatomist. His experiments were characterized by elegance and simplicity, like producing atrophy of the right olfactory bulb, as you can see in this insert, by surgically closing the right nostril of baby rabbits. Bernhard von Guden had a tragic end. He went for a walk with one of his patients, Ludwig II, King of Baviera, who had just been deposed on the basis of the diagnosis of insanity delivered by Dr. Guden himself. A few hours later, both were found drowned. The official story was that the deposed king tried to commit suicide, Dr. Guden tried to stop him, and in the struggle, both men drowned. Now, let's go back to the anatomy of the dorsal longitudinal fasciculus. After the DLF short fibers pit stop at the periaqueductal gray reticular formation and the dorsal tegmental nucleus of Guden, axons from neurons in these structures reintegrate into the DLF and, in conjunction with the long fibers arising from the basal forebrain, innervate several brainstem motor nuclei. The DLF innervates 5 parasympathetic nuclei. The Edinger-Westphal nucleus, located at the upper midbrain, as you can see in this specimen, and better appreciated in this enlargement, the superior and inferior salivatory nuclei, as indicated here, and the dorsal nucleus of the vagus and visceromotor region of the ambiguous nucleus, as illustrated here and here. In addition to innervating parasympathetic cranial nerve nuclei, the DLT also supplies 3 branchial cranial nerve motor nuclei: the motor nucleus of the trigeminal nerve, as illustrated here, the motor nucleus of the facial nerve, as illustrated here, and the ambiguous, as illustrated here. In addition to visceral motor and branchial motor nuclei, the DLF also innervates one somatic motor nucleus, the hypoglossus, as illustrated here. As we initially mentioned, the DLF is a two-way tract, descending fibers that we have just described and ascending fibers terminating in the basal forebrain, which we will now describe. The most caudal of the ascending fibers seem to originate from the solitary nucleus, some non-stop and some through intermediary contacts such as the dorsal tegmental nucleus of Guden, the reticular formation, and the periaqueductal gray, reach the basal forebrain. In addition, the dorsal tegmental nucleus of Guden incorporates olfactory and gustatory impulses to the DLF. The incorporation of these senses involve the set of elements listed in this insert: the habenula through the fasciculus retroflexus to the interpeduncular nucleus, and from this nucleus to the dorsal tegmental nucleus of Guden. Thank you very much for your attention.